Good morning. Good morning, everyone. Welcome to Grand Rounds for the Department of Family Medicine at Mount Sinai for this academic year. We're delighted to open up with an exceptional presentation by one of our own. My name is Red Schiller. I'm interim chair of Department of Family Medicine at Mount Sinai and president for academic affairs at the Institute. On a personal level, this is just a great opportunity to showcase Dr. Sarah Nosal, who's currently president-elect of the American Academy of Family Physicians and soon to be installed as president in a couple of weeks. She also holds the role of vice president for innovation and optimization and the chief medical information officer at the Institute for Family Health, as well as the assistant professor at Mount Sinai in the Department of Family Medicine. She completed her medical degree at the Albert Einstein College of Medicine and her residency with us at the Institute for Family Health in the Mount Sinai Beth Israel residency. And she's practiced as a family physician at the Institute for over 20 years. In her leadership role at the Institute, Dr. Nosal helped develop our IT infrastructure and help the Institute become a national leader in data sharing and equitable information sharing and access. Just a key person in our whole EPIC enterprise. She was instrumental in shaping the Institute's response to COVID pandemic and the transition to the new normal, as well as rolling out our comprehensive telehealth services and vaccination sites for COVID. She also focuses on the care of marginalized communities and the uninsured and has shared a role as the medical director for the New York University and Einstein student-run free clinics for years. Another exceptional contribution that Dr. Nosal has made. As a member of the AAFP, American Academy of Family Physicians, since 2004, she served as chair of the AAFP Commission on Membership and Member Services, chair of the Commission's Special Constituencies Subcommittee. She's testified before the U.S. Senate Select Committee on Aging about the role of community health centers in providing care for patients of all ages. Can't tell you how proud I am and excited we are to have her start this off. And on a personal note, her partner, James Mumford, was just a key person in the development of the residency program. James, we miss you dearly, and we're really glad to have Sarah this morning. Thanks, Sarah.
Thank you so much for that introduction. I'm going to go ahead and share my screen. And if you can let me know that you are seeing what I hope is my opening slide.
Yes.
Wonderful, thank you. Good morning, everyone. I'm Sarah Nosal, and I'm proud to be a family physician. I'm really proud, as you heard, to be a graduate of our program and to be a clinician here at the Institute. Today, I'm really talking about what you guys already know from the work that you do, that medicine is a social justice issue, and really family medicine as advocacy. So as you heard, I'm president-elect, almost rising president of the American Academy of Family Physicians. And at the end of my presentation, I'll talk a little bit more about the details of that organization. You heard my roles here at the Institute. I'm actually going to flip up my presentation that I do sometimes when I'm going around to states. So as a member of the board of directors, we go to chapters all around the country and share what the Academy is doing. And often I go through the details of what the Academy is, the structure that's supporting our chapters, and then I'll talk a little bit about advocacy work that's happening or has been happening. I know that this is an incredibly difficult time for me, and I'm sure it is the same for all of us who care passionately about the work that we do, the patients we care for, and our own identities that are at risk, marginalized, and those of our patients and families as well. Access to good health and healthcare should be a universal right, not a privilege. So right underneath that, you guys can see that that's actually the policy of the American Academy of Family Physicians in detail underneath. Social justice in medicine advocates for fair treatment to eliminate inequities, recognizing that health is a societal problem affected by systemic discrimination and unequal distribution of resources. So, stand up and fight back. I know that that is at the core and heart of what we do in family medicine. I'm going to give you examples of what we as the American Academy of Family Physicians have been doing on behalf of you, our members, over the course of really since I took my role and really since November of last year. That photo on the left is in DC. The day that they turned off the funding to the Institute, I went and protested at the White House that evening. And the photo next to it is a number of Institute clinicians, physicians that I trained with, but that was in 2011. After I graduated, we all gathered together in Zuccotti Park as part of the protest and to give out free flu shots. So on November 19th of 2024, we made sure that our commitment to vaccines, that healthcare for all was known. Initially, we really thought we would be able to send information to our members sort of internally. Sean Martin, who is our president and CEO, was communicating internally to our Family Medicine Action Network. I still encourage you to join, but certainly our information is more public as well now. We began to gather our advocacy resources as we have in the past when there are threats to the health and wellness of our organization, our patients, our family doctors, our communities. You'll see below these group of 6 important primary care organizations that come together when they speak out on key issues, both for strength and for protection. We spoke early about the Trump executive actions, about the taking down of the federal websites. Our president, Jen Brule, making a commitment for the AAFP on our purpose. Family medicine has always been about ensuring that every individual, regardless of who they are or where they live, has the opportunity to achieve health. These values are not just guiding principles, they are the foundation of our work. They transcend politics and remain central to why we choose the profession, to serve patients and communities with compassion, evidence, and advocacy. By February 6th, we were calling out the federal data and guidance removal as that group of 6. Leading physician groups were speaking out about our concern for Medicaid, that it must be protected. And the reason that announcement came out on the 13th was on February 12th, just moments before I was to speak before the Senate Committee on Aging, was when the version of the budget that included those significant Medicaid cuts had come out. I had the opportunity to speak that day before the Senate Committee, thanks to an invitation from Senator Gillibrand's team. And I got permission from one of my patients here at the Institute to talk about her recent struggles, having moved, having lost her SNAP benefits, having no longer the soup kitchen that she would previously get warm meals at, not knowing where to pick up her medications from her pharmacy. She was a dual eligible individual, an older adult, who relied heavily on Medicaid, Medicare, and her local community and benefits in order to survive day to day, and had quickly lost control of her diabetes. I see this patient very regularly. I think of her and the importance of sharing the stories of our patients as part of our advocacy work each time I see her. By February 15th, there was an all-out media campaign calling for the protection of Medicaid. I was participating in podcasts to try to speak to all family doctors about the importance of telling their story and preparing us for broader national advocacy work. Speaking out in support of Medicaid, both myself and other members of our team were writing articles about the impact of both Medicaid cuts, the HHS workforce reduction. By March 3rd, again, a media campaign engaging people like yourselves to be able to speak out both in social media, send letters to your legislators. By March 10th, we were calling not just responsive to the cuts that were occurring, but really what the direction we should be going in, that there's the commitment to long-term investment in primary care within that legislative package, which overwhelmingly was lacking, but was spoken to as though that would be something that would be supported. By March 12th, we were seeing the termination of multiple grants at NIH. real concerns about how vaccines were going to be addressed, and lack of research. This is just an example of the multiple social media and public-facing information that gets put out by the American Academy of Family Physicians. I know many of you already follow us online on Instagram or Facebook or still existing Twitter. And we're also on Threads as well, and actually get quite a number of people following us on LinkedIn. This is just more of the examples of the kinds of topics we have been actively addressing. So each of these that you see a public press release, behind the scenes, there's also a letter that's being sent to a congressional committee, a head of a department, the secretary. Each of these public-facing press releases are rooted in deep information that the American Academy has put together with details of what action should be taken that are shared with our legislators or the appropriate leader. Important, you can see in front of you, besides also Medicare, vaccines, concern for disaster in our healthcare system, alarming threats to public health, specifically about the Senate reconciliation package, where we really advocated strongly, hoping that we would get a better outcome there, response to the immunization schedule, infringements on the medical care and patient-physician relationship. So really all of those things that happen in our exam room, whether they be abortion care, gender-affirming care, whatever kind of care your patient needs, that care is an agreement, a relationship between the physician and the patient, making the correct choices for what that patient needs, and that care should not be infringed upon by the federal government. On June 24th, we had over 320 family docs present to DC. These are all those individuals who were there to speak in support of our patients, trying to protect the CDC and immunizations, safeguard Medicaid, which was looking at 72 million people that are receiving care through Medicaid, and looking at like 30 plus million receiving cuts and being impacted by those cuts. Medicare physician payment reform, and also within that bill, where there was a little bit of success, they were preserving student loan repayment programs. By July 28th, we now became aware that USPSTF was also going to be significantly at risk. By August, we knew that mRNA vaccines funding was being pulled. CDC and the turmoil at the CDC became really clear September 3rd. I want to speak a little bit extra in a moment. This is just the announcement of our fall immunization schedule. We've heard from lots of you guys, and I appreciate it, and I want you to know how important it is to us too, that when we lose guidance and evidence-based guidance from the ACIP and CDC about vaccines, where do we go? And really leaving a void, an empty space. So the American Academy of Family Physicians, the American Academy of Pediatrics, the American College of Obstetrics and Gynecology, and the ACP, which is the Internal Medicine Professional Group, all of us have been working with the Vaccine Integrity Project to make sure there are still evidence-based guidelines for vaccines. We would like the full restoration of ACIP with appropriate evidence-based resources there. That is the gold standard. We do not want to replace those, but we also know that our members and our patients can't be left in a void. So we first addressed what is on all of our minds, which is the current respiratory season. So what you see before you are the COVID, RSV, and flu guidelines. We were almost all in alignment on the guidelines across all of those organizations. I would like to say ours are the most evidence-based, but we're almost all in alignment. And I would encourage you to visit the AAFP Vaccine Hub for additional information. And then just this past week, we had the privilege of going as the group of 6. So all of those individuals at the table with me are the current presidents of the 6 other groups. And in that particular shot, we are speaking to the Democratic Doc Caucus. So the Doc Caucus is the group of individuals who are physicians, who are actually legislators, doing the work of making laws now, but have been physicians or sometimes still practicing in their lives. Our key topics were teaching health centers and graduate medical education, National Health Service Corps loans, community health center funding, continuing the flexibilities of telehealth, and certainly vaccines and all those pieces related via the CDC. And so finally, on the 10th of this week, after much thought and consideration and significant concern, the American Academy of Family Physicians called upon the consideration of Secretary Kennedy's ability to serve. Similarly, that same day, the ACP also released a statement, a little bit different language, but similarly really calling into the question the ability of our healthcare infrastructure to continue to function, and that in the state of chaos that has occurred, that's impacting people across the aisle. So those, I hope you guys are submitting some questions. I'm going to talk now a little bit about the American Academy, which is the foundation of all of this work that I've been able to tell you that's been happening, and the advocacy work that's been happening on your behalf. And then at the end, I will be able to, there should be time to answer questions. I'm going to check my phone to make sure I don't have any messages telling me anything crazy is happening. Okay, we're good. So the American Academy of Family Physicians. So foundational, strategic, inspirational, and aspirational. So this is our vision, our mission, our member value statement, and most importantly, how we incorporate DEI. Our vision really being to transform healthcare to achieve optimal health for everyone. Our mission really focusing on families and communities, improving the health of patients, families, and communities. For our members, really advancing the specialty of family medicine, enhancing health, and strengthening member voice, which I hope you've already seen in a lot of the work that we have been doing. And that diversity, equity, and inclusion, initially when we first considered DEI years ago, it was sort of its own pillar that was outside of all of our work. And we realized that that didn't make it possible to make sure that all of the work that we're doing incorporates and weaves throughout it and considers how we have addressed diversity, equity, and inclusion in that work. So our strategic plan is really broken into 4 key segments. So a public-facing plan that is elevating family medicine, that's making sure communities at large know about family medicine. A physician portion that's really about enhancing the well-being. This is a hard time to be a family doctor. The professional, like strengthening our future, both through education, CME, opportunities, leadership training, and practice, really improving systems, payment structures, all of those pieces that impact like how our offices run when you graduate and where you get to go work, how you get to be paid, how that work happens. So this is a little bit more on those 4 pillars. That public facing is both broader campaigns in the community. We've been have a huge group of family docs who do lots of media work online and get lots of pickup on TV, radio, podcasts, print media, online media more, making sure that patient choice and understanding who's the leader of their healthcare team, and then all of our significant work and policy decisions that are happening. As physicians, that focus on well-being is really about fulfillment. We had done early work for a number of years on well-being, and lots of family docs, and I think some of us have completed the physician well-being training program. We are sort of taking that to the next level. In the spring, there'll be a new, more enhanced well-being training that integrates even more of the pieces that our people who participated asked for, really about building community, professional development, and then expanding clinical competency, making sure that you have new skills, or if you lost a skill over the course of some period of time as you change the work you were doing, that's really there to keep enhancing those skills of our family docs. That practice focus, driving innovation. I don't talk much about it, though I think you guys know I care a lot about informatics and IT. We have an amazing collaboration with Rock Health, doing early AI research and information gathering on what we need to be having and how to take the lead in primary care, and making sure family docs are taking that lead, so that as we roll out those new systems, that primary care is at the core and at the center, and that we're giving us the kind of innovation that we need. Really working towards investments in primary care, both we're collaborating with states who are able to get increased investment, and how we're going to leverage that on the national level. And payment models, which in particular were cut back by this administration, and how are we going to get new, more innovative, value-based care payment models, not just back, but better than where they were before. And I'll talk a little bit in a few minutes about strengthening our future and the profession. A huge part of that is influencing student choice. We know that we have seen a shift away from primary care and what a great need there is. And we also know a lot about what attracts students to family medicine and have a new campaign that's had a significant investment to do that. Really making sure our residents are engaged and as they transition out of residency. So you guys who are residents on this meeting, I'll talk a little bit about some of the things that are specific for you and some of the advantages right after you graduate and being a member. So we talked a little bit about each of these already, so I'm just going to go through them quickly. And these are just some of the initiatives that fall under each of those. So I talked a little bit about the Consumer Relations Project. We have advocacy ambassadors who are really reaching out in the community. So when I know a lot of you guys have been at sites where our local legislators have visited our clinical site, you can also go and visit their offices while they're in town. That's hugely impactful, and the American Academy can help you set that up, particularly if there are pieces that are really you're passionate about and want to make sure to be able to speak with your local legislator about that are impacting you at your clinic and your patients. And our continued work on Primary Care for America, which is this collaborative program across different organizations, and really about influencing policymakers and to be thinking about and leveraging, primary care focus. We have a really great career benchmark dashboard. I will touch on that later with a link. I would love you guys who are all graduated and working to visit that and share and contribute your salary information and information about the kind of work you do. That really helps make it possible, particularly as other organizations are negotiating with hospital systems or looking at what kind of, when you're graduating as a resident, how much should you be making? What's an appropriate salary? It gives you the real data and information on that. Well-being we talked about, and making sure that breadth and scope of family medicine isn't lost. For you guys in residency and for our residency educators, we have created an intensive value-based care library. It is free and available to you. I encourage you to use it to educate residents. Lots of employers have indicated that often residents graduating don't have the depth of knowledge on value-based care that they need and expect for them as they're entering practice and as they want to take leadership roles in a new organization. I spoke a little bit about AI, and we talked about advocacy, but on the systems and payment level, we actually meet with all the major payers annually to really talk about focusing and leveraging and prioritizing primary care. I'm going to dig in a little bit more in a few slides on our Strengthening Our Future and about the student campaign, which is Be There First. We have a Family Medicine's Champions program that's actually training people in the community as well as clinicians or staff people who are interested in really making sure that elementary school kids, that the high school kids, the whole community, before they're thinking I'm going to go into healthcare as a career, before they're in med school, are aware of and can know the benefits of family medicine. And the early career work that I talked about a little bit for the PGY1s, PGY3, and really getting you prepared, and then the benefit of becoming a new physician. So I'm just going to tell you guys a little bit about who our members are, and then shortly we'll finish up and have time for questions. So we have about 128,300 members. Active members, you can see, is that first section. Student members and resident members are much smaller portions. Of who our members are, so now 74% of our active members are employed, but more interestingly, so for you guys who are about to graduate, 90% of our new physicians are employed. So as people who are leaving training, it is much less common that people are opening up a office or a brick and mortar or even a virtual care center as they're graduating. About half of all of our members are female. 27% of our total membership are new physicians, meaning people within those first 7 years of training. And one of our largest growing segments is doctors of osteopathic medicine, DOs. As I said, practice environment is largely employed. A smaller portion are still sole owners or partial owners of practices. FQHCs is actually catching up. We're almost 11% also for where people are working, and that is another growing segment. And of our active members, people also tend to be working in a hospital system, so more than 55%. The average number of patients encounters a week is about 85. So you can see that people are doing a lot of various work because that means they're doing a lot of other things. And about 9%, but also increasing, and we think it's moving towards that same 11%, are operating a direct primary care practice. And so that is one of our most popular. And we have a great conference that I got to attend for direct primary care, but we're seeing more and more members pursue direct primary care and more training for residents to have that as an option when they graduate. Trends overall in membership, as you can imagine, we are not going all the way back to 2020 here, but we did take a hit during that time. We saw some increases and rebounding in 2024, but a little bit of a dip again. That dip came from people retiring, but doctors are going to be retiring. We know that there's a family doc shortage, and that is also reflected in our membership. And we want to make sure that we're meeting the needs of our new family docs who are graduating, who are asking for and needing different support and skills as they graduate. So this is the PGY3. So you guys who are third year residents, I want you to know, one, we have a insurance that you can get for free. That is for disability insurance. And that when you graduate, so you get that for your third year, you sign up for it. And then when you graduate, you get it for free again for your first year as a new physician. That is an incredible opportunity. I really encourage you to take advantage of that. You don't need to do that to be a member, but that is a member benefit. And then separately, our fees for membership is for your first year, $100, second year, $200, third year, $300 after you graduate. So those first 3 years, our new physician members really said, like, I'm struggling to be able to move into a new place, settle in a new town, have a car, transportation to where I'm going to work. And this was really a reflection that the AAFP wanted to make sure that our new physicians know that they were valued and how important we want to keep them as part of the academy. I think this might be something we have questions about, particularly from the Institute, who has a really good understanding of how the match works and has had our own successes and struggles in the match. We matched more individuals into family medicine this year than ever before, more than 5,000 individuals. That shows 16 years of consecutive growth. We've opened more residency programs across the country. That's 800 plus residency programs. We still need 40,000 additional physicians by 2040. And there's some nuances in this data I'm not going to get into on the slide, but I'm happy to talk about in questions, in that we didn't always match people to the place they wanted to be at the start, even though many times on the data shows that often they ended up where they wanted to be later, but it didn't work out the first time. And so we actually have an entire initiative at the American Academy of Family Physicians headed by Karen Mitchell, who is really well-versed in the work of residency programs, cross-working with all of the other family medicine organizations involved in residency teaching and planning, to sort of dig into where this mismatch is and how to both not just get people to come into family medicine, but how to make sure that this match process is more successful and much less tedious for all of us as well. This is that campaign that I talked to you guys a little bit about for med students. So I don't know how the youngest people on this webinar feel about it. I can tell you that I was told I'm not supposed to like it, and I don't particularly enjoy it. I am definitely of a different generation, but I certainly hope, and having done significant crowd testing and testing with younger individuals who are the target audience, who like the colors, the message, the language, the wording, really talking about being the first person as that family doctor, the first to refer, review, reassure, to be in a situation, the first to champion how medicine can transform the community, that these were messages that really resonated with young people and people who are interested in family medicine and people who became interested in family medicine. We've had the most engagement from young individuals who are pre-med, pre-health, in med school, engaging in this campaign that we've had on any other outreach to this age group and to this cohort in the past. So we have looked at providing additional funding and additional years funding in this endeavor where we're seeing really, really good engagement. So last part I really want to talk about is your membership and your voice. I know you saw at the beginning the advocacy work that's being done on your behalf based on the policies that were created, thanks to the work of so many people on here and across our country who make policies for the American Academy of Family Physicians, which makes it possible for us to speak out. Places where you can see your voice at work. there is a publication called AAFP Voices. These are both articles from leaders about individuals, about residents, about students, about topics, about pieces that are happening inside and outside of the academy and major topics. I encourage you to subscribe to or follow AFP Voices. I talked a little bit about the group of 6, those individuals, and we do have a webpage that has all of the statements with some in-depth information that we have released regarding, all of the relevant pieces that are happening and the work and the coming together of this group on really advocating for the health of our communities and patients. I would love, and I know this will be circulated to our communities, to our attendees, and particularly to our residents, I would love you to engage in our speak out. So whenever there's a significant piece of legislation, a new topic coming out that we know that legislators really will want to hear from you. So for anyone who's ever done advocacy work or lobbying before, there's like some 20-year-old answering the phone every single office and reading, checking their email, and they have like a little check pad and they're saying, this is how many people said yes, they want this. This is how many people said no. So it feels like, does this make a difference? There is a human who is counting each of these responses to help guide our legislator to say, this is what your constituents are saying. They are asking and telling us this is important to them. And if people don't, even if you think, well, they're already on my side, they already know that they're going to do what I want. I'm in a community and I've elected people who are representative of my values. If they don't hear from you and they hear from the other side of people, they will start to look at, what are my constituents really looking for? So we've made it really easy. And when there's a brand new event that comes out, you'll often see these on social media or you'll receive them via email, but you can visit our Speak Out site at any time. And there are multiple topics at any time that you can take action on. It'll send a pre-filled out letter. It'll use your address and your specific legislators with very little work on your part. And you can also customize it for yourself. We've had really great engagement with our podcasts. We have multiple different podcasts, both on experiences of family docs and the work they're doing that's really meaningful and important, on some of just primary care and what needs to happen in primary care. You see the Faisal and Primary Care podcast, and then really the Fighting for Family Medicine and those advocacy updates. So if you're like, I feel like I'm overwhelmed and I don't want to just hear horrible things, and so you've been staying away from sort of social media or media about these things, listening to Fighting for Family Medicine will give you like a really accurate, thoughtful, evidence-based, and action-oriented, what can you do, who could you talk to, approach to doing it, and in the podcast format, if that's what you enjoy. And I hope that some of you are noticing Dr. Mark Levin. I got to work with him at Future, which is the conference for residents and students. And he also had just completed a podcast talking about some of the amazing international work that he does. Really, it's that these stories are about making sure that our residents, our students are aware of like both the good work that family docs are doing and the opportunities that are there for them. Also, as a member, you guys will have received a member satisfaction survey. It really matters what you fill out. The board of directors reviews this data deeply. We use this information to develop that whole strategic plan. Those 4 pillars that you saw is based off of what our members said. This is what we want you to be focusing on. So we have used that information from 2024 to help develop that strategic plan and before, and we will continue to use each year's membership information to guide, prioritize the work that we do. So right this second, so for residents who are on this call and all members who are on this call, right now, the written testimony for the Congress of Delegates. So the Congress of Delegates is the place where we all get to kind of debate what is it that all family doctors in the country are going to say they stand for. This was really what got me into the academy in general. Dr. Linder Prine, who was a past attending at the Institute, who I know many of you know, was like, just come to this thing. And it was the New York State Academy of Family Physicians Congress of Delegates. And it turned out their resident delegate didn't show up. And so they asked me if I wanted to be the resident delegate, and I did. I thought that was great. And I got to testify and say what all family doctors in the state of New York should stand up for our patients. What rights should our patients have? And it passed with helping fight for those pieces there. And then that information and that policy can go to our national level, to our Congress of Delegates with the American Academy. All members, regardless of you being a delegate or not, all members can log on and give testimony right now on recommendations and resolutions that I guarantee impact the care of your patients, and that I know, having read them, you guys care about. So we will circulate this link, but it would be so powerful for you to put what you care about, what you're in support of, why we should be making these choices. This is a really profound way to absolutely get the work that the Academy does to reflect your values, your experience, your patient care, and the importance of the community we serve. The final places I'd like you guys to think about visiting. I talked about that really popular website where it tells you the amount of salary given areas, kinds of work people are doing around the country. So for those of you guys who are working in private practice, who are on here, who are employed, who are part of a hospital system, family docs, please log on to afp.org/worth. And it's a really quick survey. It asks you just a few questions about your job, but it gives a powerful way, because the more data we have, it becomes, more valid, and makes it really useful for both new grads and people who are changing career to know what should we be expecting as a family doctor, and in what community, and where will that be. The places that are really amazing to connect with other family docs, where I got my start, was at the American Academy of Family Physicians Leadership Conference. I know a bunch of our faculty have really represented us well. They have 5 different groups: BIPOC, international medical graduates, LGBTQIA+, women, and new physicians. And New York State sends people each year. Residents can attend as general registrants. You have to be an attending to be one of the 5 groups. Students and residents, I have seen lots of you guys at our booth at Future, which is our national conference for residents and students. Our Direct Primary Care Summit is our most popular. We've actually maxed out the hotel, so it's really hard to get a spot. So if you want to go next year, you definitely want to get it early, and we are going to probably need to look for a larger place for that conference. And finally, as you heard from Dr. Schiller, our big annual, both educational and right before that, our Congress of Delegates will be in October. And on October 6th, I will be installed as president of the American Academy of Family Physicians. So this is just a shot from one of our past Future conferences. It is one of the biggest joys is to meet all of the students and residents. I know for you guys too, when they bring their energy, both on rotations to the Institute and to our practices, and then when we get to go and meet them at Future for both recruitment and just for education. And these are some of my favorite people in this photo, and some of our favorite leadership and attendings from across different New York programs. Thank you so much. I am open to questions. I don't know how I actually become open to questions. Someone else has to turn that on for me.
Yeah, well, Sarah, thank you. This is that was exceptional. I think one of the things that you're highlighting is family medicine is not a spectator sport. And I think many of us over our careers, we realized the work that we do outside the exam room, in our communities, and in working with legislators and political leadership is really crucial to ensuring that the work that we do in the exam room is optimal. So thank you for that. Really inspiring, your career path. See, there's one question was, can you talk a little bit about the role family physicians and NPs can play outside of AAFP?
For family physicians and nurse practitioners?
Yeah.
Absolutely. So while I certainly encourage you to be a member, if you are a group that can be a member, because there is power in coming together, just as we work collaboratively with those other organizations. I would also tell you that that nurse practitioner organizations also are doing great advocacy work, and that cross collaboration with nursing is really common in a lot of, like, our health center work, our funding work for training, particularly in marginalized communities and excluded individuals from training. We do collaborative work with nursing, because those are things that impact. If we don't have all of our partners of different kinds of training, we are not successful. In addition, everyone can visit locally their legislators. So as we said before, I think our NPs were at a lot of the sites where our local legislators were there, where they're working in that community, but you yourself can communicate with the staff at that local office they will be so excited to hear from you. The fact that you're training in that community, that you're considering, or I have heard maybe staying on to work in that community, they want to know, what did we do right? What do we need? How do we get more people like the nurse practitioner who's trained in our community and has now decided to stay? How do we do that? And so all of our legislators are the most excited to meet students, residents, NP residents who are finishing training, because you are who they want to woo, and they want to know, what are we doing right or wrong to make that happen, because they know how important the care you're going to provide in that community is.
Great. Thanks. One question I had is, I think what we're realizing politically in this country is the role that states play as opposed to the federal government. And really, I mean, whether you look at the vaccination issues, access issues, what's happening with Medicaid. I'm wondering if you could talk a little bit about what the State Academy is doing, and and since, as you mentioned, that's often the birthplace of activism for residents and faculty.
Absolutely. And I'm going to broaden it a little bit to talk about that. In the past, when the AAFP used to talk about what our job was in advocacy, we used to say that we did federal advocacy, that our staff was focusing on the stuff that was happening in the federal government. And you are dead on that. That is not anymore what's affecting the entire country. That, in fact, the kinds of decisions made in individual states create significant disparities in the kinds of care that patients can receive, that physicians and clinicians can provide, that the kind of state level politics that are happening actually start to feed into lots of other states and impact the health of our entire nation. So we now have an Office of Federal and State Policy and an amazing AFP staff person and team who do that work and keep their hand on the pulse of each of the things that are happening in the state. So that's one thing to just know across the country that that's happening. Separately, to let you guys know about the New York State Academy of Family Physicians. So we have I'm sure on here, I can't tell who's on this meeting, but I'm so glad you're here. Thank you. And I'd love you to message me after to tell me. You guys have awesome faculty who've participated from Mid-Hudson, the Harlem and downstate residency programs. They've all participated in our New York State Academy of Family Physicians Congress of Delegates. They have brought important GME resolutions there. They've brought patients' right. They've brought patient privacy. All of those things have been brought and become policy in New York State, thanks to work from people within the institute right now. So I encourage you to turn to your educator in the precepting room today and say, can you tell me how you did that? And can I get off to go there? And what does that look like? Or often the meetings of commissions. So there's a commission structure for the various, so for advocacy, for education, that for membership, there are multiple different commissions, even on the state level. And many of those meetings are virtual. So even if you can't get away easily as a resident, but you just want to be peer in and see what's happening, that is something that you will be welcome to do. Our current president is out on Long Island. Our previous presidents, we've had multiple presidents from New York State Academy, from the Institute, including our CEO, who recently resigned CEO, to our Mid-Hudson, upstate doc. So we are very connected and committed, but I would encourage you just to get your feet wet, just listen if you have an interest, and ask your attending, because I bet they'll tell you who the person in your program is who really knows what's available there. The next piece that I also encourage you guys, you have a lot of requirements for presenting academic information, and that we have opportunities. There's a really nice poster presentation at Winter Weekend, which will be coming up in January. I know that seems far away, but it's actually closer than you think. So if you're looking for other opportunities and you'd like to take a ski trip, I would encourage you to look at the New York State Academy website, also for opportunities to present the really good work that you're doing in posters and presentations. And I know some of our attendings are doing larger presentations on academic topics as well.
Great, thank you. It's really good summary. One question is about the role that urgent care is playing and the number of people who get trained in family medicine but actually choose urgent care. Does the Academy sort of track this and sort of address kind of the trend of what really amounts to shift work for many people, and in the lifestyle benefits of that particular job as opposed to a continuity practice?
Yeah, we actually do track, and through that membership survey, we look at the different kinds of roles that that family docs have, and it actually is very different at different times in many doctors' lives. So as we survey even the same people over the course of their career, that people may be doing for a while urgent care, we have a lot of docs, and we've had a lot of we play a large role in advocacy, making sure people can maintain their emergency room privileges. We have people who are working, you know, doing full surgical privileges, and you know, surgical OB, obstetrics in parts of the country. It's really varied depending where you are, what kind of work. I would tell you that the role of the American Academy of Family Physicians is to support all of our family docs, regardless of the kind of work they're doing. And most of the asks we get is to help people transition in and out of those different places. So you may choose to do homeschool your kids and do urgent care for a segment of time of your life. And that makes a lot of sense. And then you might want to be able to get back into doing residency teaching and procedural care, but you've maybe lost some of those skills. So we offer that you know, continuing medical education, that stuff to get you caught up on the new ultrasound requirements that you need to be able to do, and have a course that's available to do that. And that's really been our commitment, and that to meet whatever family doctors are doing. We have a tremendous amount of family physicians who are doing either very, very small amount or are not doing patient care. While I certainly want all of us, I love patient care. It's such a wonderful balance to the work that I do. I also know that family doctors make excellent leaders. They're excellent heads of hospitals, clinics, informatics programs. And I'm proud for family doctors to be doing that work and figuring out how we continue to support them as an academy. Like those are all the kinds of obligations we're trying to meet as the AFP.
Yeah, it's really a challenge. And I think, you know, one of the issues is sort of falls under this well-being, because some of these choices are really, as you point out, are lifestyle choices that people have. And, you know, and primary care is hard. You know, the demands are increasing, and, you know, based on this morning, one of the additional responsibilities is advocacy. So when you wake up in the morning, that's part of what's on your agenda. Another question is, you know, what the Academy is doing about funding for FQHCs and teaching health centers. I mean, you sort of touched on that.
I'd be happy to dig into it a little bit more. We really feel closely related to the work of community health centers and federally qualified health centers. And so Q, who is the national leader of the National Association of Community Health Centers, he and I have had the opportunity to meet several times. We are strengthening that collaboration. We are actually sending our administrators to their training to help get a better understanding of the work and role of federally qualified health centers and community health centers in the family medicine gamut. So that's before all of the advocacy work. Like that relationship, we only see that growing in the next few years, that where family medicine is likely to happen and where we're likely to see a lot of opportunity for innovation and growth is in this realm. I know at times it feels like we are kind of like getting the short end of the stick for a little bit, but really we are at this turning point where there is potential for growth. Even in the current administration, whether it has been acted upon yet, in the priorities is that we would have a strong network of community health centers that would be both rural and urban, that would be a network that was well funded, that each individual would have a primary care clinician that would be meeting their needs, and that would be one of the main mechanisms to do that. Now we have to hold each administration, you know, to the statements that they've made, but that is how we're supposed to be making America healthy. That is what is being espoused. And we know actually that is how you can make America healthy, is through having, you know, a strong network of community health centers and primary care clinicians available to those communities with continuous relationships. And our advocacy work is for multi-year. We would love permanent funding. As you guys probably know, we've had only these extensions. I would tell you that after meeting with legislators on Tuesday, they largely said we could probably only expect a 3-month extension again, which was pretty disappointing. But they also understand that like our goal would be multi-year, 3 to 5 year, and our goal would be permanent, permanent funding. So for our teaching health centers in particular, but that we also bundled in that the National Health Service Corps loan repayment and community health center funding in general, because we know how critical those are for you to stay on after you graduate or be even able to commit to working in this environment.
A great answer. Thank you. It's, just realizing that the place where a lot of these ideas meet actually is where the care is delivered at FQHCs and community health centers. And so a really good point. One other question is about advocacy from the Academy on medical school curriculum and impacting schools. If you could just touch on
Absolutely.
what's
So
being done.
So for those of you who saw that slide before, and we'll send out the link again about putting in some of our resolutions right now at the Congress. So if you are a member of the AFP, please go put your thoughts on this topic. We definitely want to hear from you. The reference committees will read all of the comments to decide. Many of those resolutions are about whether we should have comprehensive reproductive health training, whether it should be opt-in or opt-out. Those are resolutions that are right now before the Congress of Delegates. So we can't tell the LCME, and we can't tell the ACGME they have to do something, but we can suggest to them and say we would recommend and write them a letter of that our members would have said that they would recommend that we have, comprehensive reproductive, which is our current policy, that we would have comprehensive reproductive health training, that should be available to all people regardless of what state they're training in. Our current policy that was voted on is an opt-in rather than an opt-out. That is up for debate in the resolution, so please feel free to put your comments. But that is exactly the kind of policy that gets developed by our members, by you guys on this call, that then I am on the board and I have to follow our policy. I get to sign my chair gets to sign amicus briefs in support of all of the things that we really care about for our patients across this country, because you have shown up and we have policy that then says to the board, you need to support the care of our patients from all backgrounds, receiving all kinds of care. We need to keep the government out of our exam room. And that meant that we can be on all of those court cases and say the AAFP is in agreement that this is evidence-based care, that our priority is for the good of the patient, and that the patient and the clinician can make the appropriate care of the patient. And you made that possible through the policy and resolutions that you guys supported.
Yeah, that's great. Thanks. I remember in the 90s, California had passed legislation that to get a license in California, you had to graduate from a medical school that had family medicine as a requirement. Didn't last very long, but those kinds of interventions were requiring schools to do more at the undergraduate level in medical school is really crucial. Eric, did you have a question that you
Yeah,
wanted
I
to
do. Thank you, Dr. Nosal. I mean, timing matters, and for you to be taking the mantle at this time puts us in great hands to um, elevate the conversation and activate our membership to meet this moment. I want to circle back a little bit to some of the advocacy thing, and I want to also say to our residents that you have an opportunity here at the Institute to join our advocacy board that is doing work at the state level and on the national level. And if you're interested in that, you can reach out directly to me and we can connect you with that, because those are work that's being done daily and monthly. But on the national level, and I think we're missing our moment with what's happening with the secretary being told to go wild, so to speak, and the assault on science and the encroachment on the practice of medicine is something that all clinicians across the spectrum should be concerned about. How are we looking to elevate that message where, even though we've already called on the president to reconsider the secretary's fitness to serve in this role, that I think we need to do a little bit more, reaching across the aisle? There are physicians in the leadership in Congress who surprisingly are leaning into some of this messaging. But I think there's more that we can do, and I know there are rumblings that physicians need to take a more active, present stance. And I'm not sure how the leadership of the academy and the other bodies that you've identified we're partnering with are looking to marshal that energy that's already boiling. Thank you.
No, absolutely. And you are very correct. This is where we are in disarray. No one on either side of the aisle wants our healthcare infrastructure to work, not at all. And so that while we have been taking a thoughtful, strategic approach as individual pieces were coming up, it has become, as you know, more and more clear that there is not going to be a thoughtful and strategic response to a thoughtful and strategic approach. The ACP and the AAFP together, there are 190,000 members of the ACP and 128,000 members of the AFP. So those two groups came together and at the same moment on Wednesday, released those statements in regards to Kennedy. Separately, sometimes certain legislators will not officially meet with individuals, but will meet with individuals perhaps casually, like more like a hallway side consult that doesn't get documented in the record. We are absolutely hearing from those individuals. You are correct. There are Republican doc caucuses. The doctors within the legislature, the doctors obviously in the country, but the doctors within the legislature, not just Democratic, have significant concerns. They value the health of their constituents. These Medicaid cuts are severely impacting rural communities. We're looking at the likelihood of loss of, tremendous amounts of rural hospital systems. So we already had this huge Medicaid loss, and now we're looking at destruction of our vaccine infrastructure. The vaccines for children is at risk. Our USPSTF guidelines are questionable, and that is likely to be dismantled fully, which would mean there is no governmental way to require coverage. This, I think, is the moment. I think why the ACP, why the AFP made this statement, and this is the rallying cry that we are trying to make collectively to get all of the other physician groups, all of the other healthcare groups to sort of come together and speak out at this time. And that individual reaching out, the using those going and clicking and sending that letter to your legislators does, particularly if you're in a red or purple district, does become the tipping point. And so that each of us, whether you're a clinician or a staff person who's supporting the amazing work we're doing here at the Institute, go and send that message to your representatives. They are right now looking at who's saying this about what needs to happen, say that things are in a disarray, and it is going to make a difference. They are taking those counts. And Dr. Gale, you are right. We are at the tipping point at this moment, and we're seeing that in the country. This is the moment to act and to continue the coordination with all of these other groups.
Thanks, Sarah. That's a really good answer. Clearly, and Eric, I think bringing up the role of residents and faculty participating at the institute level around advocacy is really important. I mean, I can't think of a better topic to start our academic year than advocacy, and it's really it is crucial for all of us to look at what we can do. I mean, I think you've highlighted a number of areas where the academies played a leadership role, and I encourage all of us to look to see what each of us can do more, including talking to our patients about these issues. The role that the public plays in trying to take back some of these changes is really important. Well, it's 9 o'clock, Sarah. I want to thank you so much. This is inspiring. Your career is inspiring, and your commitment and energy is also aspirational. A number of people commented congratulations on the presidency. So we look forward to bringing you back and hearing what we can do to sort of turn this around.
Well, thank you so much. I'm so proud to be a family physician, but I'm incredibly proud to have been trained, grown up, worked, and to continue to serve at the Institute. So thanks to you, thanks to Dr. Gale. This has been, my career has been an incredible opportunity, and I am grateful for it every day.
Yeah, well, we love you, Sarah.
We love you too. Thanks, guys.
Bye-bye.
Bye-bye.